And now to NBC5 Responds. Military members and their families are having a hard time getting their medical bills paid. Our team's been hearing a lot of problems and how people are being impacted by this.
And that includes the medical providers who care for these people. They say that they have not been paid in months. NBC5 Responds PJ Randhawa shares what may be behind this.
Here's the problem. Since December 31st, medical providers who accept this special military insurance tell us they haven't been paid for any of the services they've provided, and they've heard radio silence from the health insurance company known as TRICARE. Illinois is home to several Air Force, naval, and military bases, as well as thousands of military members and their families. And all of them rely on TRICARE, a healthcare program for the military that covers almost 10 million active duty service members, retirees, and their families. Veterans and their families often use it as their primary insurance, but for active duty military and their dependents, it's mostly used for specialized medical care that's not available or easily accessible on a military base.
This is speech therapy, occupational therapy, physical therapy, surgery centers. This is across the board, any type of specialty care. Jessica Wysocki and Sophia Schlein work at this Lake Forest behavioral health practice. It's an important specialty, especially given that a recent study by the Pentagon found U.S. soldiers are more likely to die by suicide than any other cause.
We see people every single day that have, complex and compounded trauma.
The problems began on January 1st when a long-slated restructuring plan transitioned TRICARE to TriWest. It was a change meant to improve healthcare quality and cost. Instead,
there was a complete halt in payment, a complete halt in communication.
Coast to coast, TRICARE providers and patients have taken to social media to voice their frustrations about many of these issues, including unpaid claims, incorrect or outdated patient or provider data suddenly appearing in TRICARE systems, and the hours-long wait times to speak with TRICARE representatives. They say all these issues have taken a dramatic toll on patient care.
Providers are not able to, continue this way, and so they've either had to drop patients or ask them to go to a fee-for-service model.
Jessica says payment delays have already stopped some active duty military from seeking mental health treatment, which can be difficult to ask for in the first place.
It just breaks my heart because it is so hard to make that first phone call. Or, I'm not going to make another appointment because I'm afraid I'm going to be stuck with a really high bill.
Some of the doctors that they had been seeing before the contract transition are no longer in the network, or they're in the network but their data hasn't been uploaded.
Eileen Huck with the National Military Family Association says the end result of all these issues could mean fewer providers will accept TRICARE going forward.
These are providers who are in many cases taking really low reimbursement rates because they're committed to serving military families, and they rely on timely reimbursement, and a lot of them have been very patient, but it's kind of, this has gone on too long.
In a statement, Senator Tammy Duckworth says she is aware of TRICARE's problems, and she encourages veterans, service members, and providers to contact her office if they're experiencing similar issues. In a letter TRICARE sent to its providers earlier this month, it says they hope to have the issue resolved by the end of March. PJ Randhawa, NBC5 Responds.
And the TriWest Health Alliance told us in part in a statement, quote, TriWest's claim system is processing and paying claims to providers for dates of service beginning in 2025. Any care provided prior to January 1, 2025 are paid by the prior contractor, unquote. We're going to post their full statement with this story at NBCChicago.com/consumer.